Hello and welcome, welcome, welcome. We are so happy that you guys decided to join us on today. This is Breast Cancer Awareness Month, and we know that there are so many people that are affected by this disease. It is not just the woman or the man, it, essentially like the entire family and the community that is affected by this diagnosis. And so today we are going to provide you with some tips on prevention, but also when it is important and when it's time to go ahead and see a breast surgeon. This is Lessons Beyond the Stethoscope, where we provide practical tips and tools that you can use in your everyday life because we understand that life affects your health. If this is your first time joining, I am Dr. Ashley Booth. I am a board certified family medicine physician, and I am also your host for today. If you haven't already done so, you know what to do. Just go ahead and subscribe. It is absolutely free. We will not spam you. We just want to make sure that you get some really good content, something that we know that you can absolutely use in your life. So do that, and also turn on your notification bell so that you will know when we're putting out things so you won't miss it. But this is episode 21, Beyond Breast Surgery, breast cancer prevention tips from a breast surgeon's perspective. And today we have joining us Dr. Shelly Ringer. She is an MUSC Associate Professor of Surgery who is fellowship trained in breast surgery at the University of Pittsburgh Medical Center. She practiced at the Hartford, Connecticut area for about 6 years before she moved to the Hilton Head area about 9.5 years ago, where she is also the medical director of the Hilton Head Hospital Breast Health Center. And Dr. Ringer is very committed to making a difference in the lives of women that she treats by providing them with personalized care and by being an advocate for them. So thank you so much for joining us on today, Dr. Ringer.
Thank you, Ashley. I'm so excited to be here.
Awesome. Well, as I mentioned, this disease affects like a lot of people. And I'm going to give a statistic. It said when they did the numbers around 2020, an estimated 3.8 million women were diagnosed and had breast cancer at that point. That's quite a few. And it is
Mhm.
affecting people as young as 20, as old as over 80. So we are seeing it and we are starting to hear more about it. The great news is that we're noticing that the mortality rate seems to be decreasing or kind of stabilizing, but it's
Mhm.
still affecting us. There's still things that are, happening, and people are like, well, how can I prevent this in the first place? So there's a few things that we can do. What are some of those things that we can start doing to start helping us to prevent this from happening?
You got it, Ashley. So, unfortunately, this is something that affects everyone, whether personally or through friends and family. I don't think there's anyone who doesn't know someone affected by breast cancer. Um, as you said, luckily it is very curable, but amazingly scary. And so we all want to do what we can to prevent having to go through any of this. There are things that are actually in our control that we can do. And I tell women, we know what we should do, but we're just not perfect people. We're busy. We got families, lives, all that. But in general, what you can do to help is exercising regularly, getting that heart rate up, getting moving. That definitely helps. Eating healthy, so eating real foods. There has been a lot of focus on BMI. So for people who aren't familiar with that, that's your height to weight ratio. And in my opinion, I think there's some controversy with that because if you're a muscular person, your BMI can be high, but you're really healthy. So I actually don't really care what someone's weight is on that scale. I care, what are you putting in your mouth? Are you
Mm.
eating foods that come off a tree, come from the ground, trying to avoid highly processed foods, trying to make meat a smaller portion of your diet, especially red meat? Unfortunately, we also know that alcohol can slightly increase your breast cancer risk. So even one glass a day increases risk. And that's easy to do, just one glass with dinner and you're there. But unfortunately, that does slightly increase risk. So those are all pretty easy steps. And I'm not saying you cut out your cupcakes. I mean, we all get a cupcake from, time to time, and we all get our glass of wine from time to time. But, for the most part, trying to do healthy things and allowing those other things in it, every once in a while on special occasions.
Okay, and I like as you said that, because what I tell a lot of people is moderation. Sometimes
Mhm.
everybody's moderation is different, but but that is really what, because I say, listen, we're here to live life, we're here to enjoy it. So I
Mhm.
want you to enjoy the things, but I also want you to be mindful when you do those things, because you want to be able to enjoy those things for a long time, right?
Mhm.
So then, okay, yeah, we can't have a glass of wine every night, but maybe a glass, once on the weekend or something here, that way you still have it, and
Right.
we're not just trying to make life boring, but then you can still, live longer to do it. But along with that, there's something that I know that you and I had kind of chatted about earlier. And when we talk about risk factors, a lot of people know that family history can play a part. But talk to me a little bit more about family history when it comes to breast cancer.
Absolutely. So, family history is an interesting thing. So, as you started off saying that, unfortunately, so many women do have this disease, and actually, 1 in 8 women will get breast cancer. I mean,
Mhm.
think about how many women you know, and so it's a lot. And we know that having a family history increases a woman's risk for breast cancer. So, more than that 1 in 8. However, we know that women who are diagnosed with breast cancer, 80% have no family history. So I sometimes see women in my office and there might be something going on, and they tell me, I'm not worried. I have no family history. So I don't think this is anything. And unfortunately, I tell them that that's not a get out of jail free card,
Mhm.
because the vast majority of women who do get breast cancer don't have family history. And I don't say that to scare people, but just to be aware that we still, everyone needs to, take care of themselves, watch out for their bodies. Getting mammograms. So mammograms literally save lives, and there is so much different information out there about when should a woman have a start getting mammograms, how often, and so it can be really confusing. And I truly feel strongly that it should be sorry um, I do feel strongly that women should start getting a mammogram at age 40 and go up until as long as they're healthy. Because that's the other thing is, when you become unhealthy, you actually should probably stop doing a mammogram. And a lot of
Mhm.
women don't know that. And the guidelines do talk about specific ages, but I think you and I are on the same page, Ashley, that you can't define an age. It's really a health status. And so I don't like to put a number on it. It's really just talking to women about, okay, if we would find something small, do you want to do something? Do you not? Because if you don't, let's not look. Um, but starting at age 40, I do feel very strongly about. And for a while, there were recommendations to start at age 50. But
Mhm.
unfortunately, we are seeing more recently women diagnosed with breast cancer in their 40s, and finding something early on a mammogram, like I said, literally saves lives.
It absolutely does. I want to reiterate what you said, because I didn't want to cut you off early, but I want people to understand that you said 80%, 80% of people do not have a family history. So I want to make sure people like fully understand that when they think about this. And then, like you said, when it comes to the mammograms truly are life saving, because that is one of the reasons why they said they started to see the decline, because we saw these early screenings and then we
Mhm.
were able to do something about it. And that's really important. I when I heard the doing it at 50 and then every 2 years, that made me
Mhm.
really nervous. I don't really
I
agree. So I'm
agree.
so
Yeah, we never adopted that here. We're like, nope, we
Mm.
just respectfully disagree, and we're going to keep going on with our 40 once a year. And unfortunately, I see so many women who are diagnosed on mammogram with a breast cancer in their 40s, early 40s even. And had they gone 10 years before having a mammogram,
Mhm.
it would be a very different conversation.
Yes. I'm so glad you mentioned that because I was thinking the same thing. No, I still agree with the 40 and every year. So
Hmm.
that's what I've strongly been encouraging my patients here. I said, listen, if your insurance is still going to cover it, then we still need to do it because, and
Hmm.
if your insurance says no, but you're able to afford it and you want to do it. And the other point that I like that you said, a lot of these preventative measures, the reason why we do them is because you want to do something. And that's another thing that I appreciate that you said. It's we have these guidelines, but like you said, if you are 75 and you're very active and you're doing all the things, then yes, and you want us to do something because you say, yeah, I still want to do the things. I still want to live life. I have a lot going on. Then yes, let's continue to
Hmm.
do those mammograms and have that shared decision making. So I appreciate you saying that too, that this is something to say, if we find something, do you want us to do something about it?
Exactly. Exactly. And I mean, I see women even in their mid 80s who are amazingly healthy and they could live to 100. So,
Hmm.
finding something, taking care of it early could make a difference for them too.
Absolutely. Now,
Hmm.
since we're talking about mammograms, when you and I spoke a few years ago, I asked you, I was like, what's the difference really? Because like a 2D versus a 3D and that sort of thing. Because I was like, I've read, but I can't quite make sense of it. And then you made it make perfect sense. So I know. So can you explain to people because they may say, oh, I'm just going for a mammogram, but someone may need to recommend, hey doc, do you think I should get a 3D or whatever? Like, what's the difference between a 2D and a 3D?
Absolutely. So as any woman who's had a mammogram knows, when you do the mammogram, it does put the breast in compression in the two different views. And so a 2D mammogram just squishes all that tissue together, takes an x-ray and looks to see what can you see or not see. And one limitation of that is you can have overlapping tissue, which means something could be hiding in there and you can't tell because it's hiding in between other just
Mhm.
normal tissue. And so a 3D mammogram kind of opens up the breast like a book. So from a patient perspective, the mammogram feels the same. You can't actually really tell the difference between a 2D and a 3D mammogram when you're having it. But from a radiologist perspective, what happens is the x ray actually creates an image for the radiologist that kind of scans through the breast. So it's like opening the breast up like a book with pages and being able to literally scroll through. And so you can see, okay, yep, dense tissue, dense tissue. Wait a minute, there's something that might look a little different. And so you can have stuff kind of stand out that otherwise might have been hidden when everything is just all put together. Now, the one downside of the 3D mammogram is there is about double the amount of radiation dose compared to a 2D mammogram. So, unfortunately, we haven't figured out how to get advantages without some disadvantages, but it is still a really low dose of radiation therapy. It is still way below the annual recommendation for radiation exposure. The other information we have as women started doing these 3D mammograms is doing a 3D mammogram cuts the chance that you're going to get called back for more pictures. So it's not uncommon that a woman has a mammogram and something is seen. They need to go back and maybe have more mammogram pictures, possibly an ultrasound. And a lot of times it ends up being nothing. And the advantage of the 3D mammogram is it can help us show when something is there, but also help us show when something isn't there. And so it has actually cut down on the number of people that have to go back for extra pictures, which costs us all money and is obviously amazingly scary. So,
Mhm.
in my opinion, the 3D mammogram really is kind of our standard at this point in time. And luckily, I think most insurance companies have agreed with this. Unfortunately, insurance companies really only care about their bottom line, but they have found that it actually saves them money by not having to
Mhm.
do these callbacks. And so I do think most insurance companies are paying for the 3D mammogram at this point in time. I'm not entirely positive, but luckily they are on board with that. So it is really, for the most part, almost exclusively what I order for people at this point.
Okay, that's good to know. And then what's the difference? Because we're using the term screening mammogram, but then you have your diagnostic. And like you said, like there, we have these callbacks and things like that. What's the difference between just doing my screening mammogram versus what would be considered more like a diagnostic mammogram? Like who would go for which one, I
Yep,
think.
absolutely. So your screening mammogram is just your once a year. You're not having any sort of problems. You're just going to make sure everything looks okay. The diagnostic mammogram is done if there's some sort of breast problem. That could be a woman's having pain of the breast, or someone feels a lump, or something was seen on the previous mammogram that they have to come back. And what happens with the screening, typically at most facilities, you go in and have your 2 x-rays of each breast and you leave. And then depending on the facility, within 1 to a number of business days, you get informed of those results. With a diagnostic mammogram, a lot of times extra mammogram pictures are done that same day, oftentimes even ultrasound, and you do find out your results that day of what's shown and what the recommendations are. From an insurance standpoint, the screening mammogram is covered 100% by, I think, all insurances. Don't quote me because I'm not an insurance expert, but that is seen as preventative. And so most women don't have to pay even a penny for that. The diagnostic is a little bit different, where usually you do have to pay a little bit for that. I don't say this because I care, as far as, I just take care of people. Unfortunately, in the world we live in, those things do make a difference. And so unfortunately, I just do like, women to be informed.
Okay, I appreciate that as well, because sometimes someone will say something to me like they're having the breast pain or something is going on. I say, okay, well, I'll send you for your mammogram, send you to have a mammogram. Or what the other thing I've noticed, what will happen is they will go for their screening, and it is the time that they're supposed to go. They normally go in November, whenever it's supposed to go, they have it scheduled, they go. But then they start answering, oh yeah, I'm having breast pain. Oh yes,
Mhm.
I did feel this. So then I receive a message that says, okay, I need a new order because this is
Mhm.
no longer screening and this is a diagnostic. And the patient's like, wait, what happened? I don't understand. I thought you sent the order. And I'm like, I did for your screening because I
Right.
didn't know anything was going on. But that's what happens. Then it changes things because, like you said, when we do the diagnostic, then they say, well, if we see something else, then do we need to do an ultrasound, and do you give us the okay to go ahead and do an ultrasound with this as well?
Exactly. And so that is fairly common. And so, the technicians appropriately are asking all these questions, but it can come as quite a surprise to a patient who thinks they're just asking, answering these questions, and it changes from one situation to another. Sometimes it means they have to be rescheduled to a different day. So it
Mhm.
definitely can be quite stressful.
Yeah. I want to pivot just a little bit because you are a breast surgeon and you are seeing women from all walks of life who come in, and there could be a misconception that you just do breast surgery on patients who have breast cancer. So
Hmm.
explain or talk to us about when someone would be referred to you, the different situations that may happen, and when it would be a benefit for someone to come and be evaluated.
Yeah, thank you for that, Ashley. Because sometimes, in my office, our office manager schedules all the new patient appointments, and sometimes people get really freaked out. Of wait a minute, why am I seeing a surgeon? I'm not having surgery. What's going on? And the vast majority of people I see never need me to operate on them. Thank goodness.
Mm.
And so, I obviously do see women who have breast cancer, but the majority of my patients don't. So I will see women who have something that's seen on mammogram and ultrasound, whether that's to kind of give another opinion of what's seen and do I agree with the recommendations. Sometimes things are seen on mammogram that radiologists say we can just follow it, and people might want just another set of eyes to make sure is that safe or not. Sometimes I'll see women who have breast pain have a lump that hopefully ends up being nothing, because the vast majority of lumps will not end up being breast cancer, but we do have to make sure. And then also women who have family history. So we have in our practice a high risk program. So women who either have a family history or who have had biopsies showing atypical cells. So a variety of reasons that women might be at high risk for breast cancer in the future. And so we talk to them about, making sure they're getting that mammogram every year, the preventative measures we talked about earlier, sometimes even doing additional imaging beyond mammogram to check to make sure everything looks okay. And then making sure they're getting a breast exam, sometimes a couple times a year. So like I said, oftentimes these women never need a surgery, but we keep an eye on them just to try to make sure everything's okay.
And the other thing I want to mention is I met you previously because we were going to collaborate, and I would send patients and could reach out to you if I needed some assistance or needed to get a patient in to be seen, that sort of thing. And I appreciated what you said, because you don't just say, okay, this is a job and I do breast surgery and that's the thing. You're like, oh, I have these systems in place. If someone comes in and they have a mammogram and it looks abnormal, we need to go ahead and make sure we have this ultrasound. I already have that defaulted, that's what's going to happen. And then I want to get these results back to people ASAP. And I appreciated that, because my own mother had gone through it and I saw how fast they moved and she was able to get her results. So that I was like, oh my gosh, she's awesome. But then I didn't know that I would need you as my physician, my own personal physician, because I had my family history. My mother had breast cancer, but she gets it after she's 60. My grandmother had breast cancer on my mother's side. She gets it over age of 60. My father's mother has. So I'm telling everybody all this, and they're like, "Oh, but you're still fine. You're okay. They got it over the age. You're okay." And and then I didn't even feel a lump, but I go and I do my first mammogram, and the technician was absolutely the best, like for me to have in
Aw.
this situation. And she says, "It's your first. You're probably going to get a call back, but it's okay. Don't freak out. It's you. Sometimes that's just what happens. That's okay." I go back, I get this call back, and I was like, "Oh, it's no big deal." But then things start to move, and she said, "Oh, we do see something. Let's do the ultrasound." So then things start to progress a little bit quickly, and then I now am sent to a breast surgeon, and they do my calculations and all of this, and I was like, my risk is higher than I knew. And then my breast surgeon, she leaves, and then I was like, oh, I need to reach out to Dr. Ringer and see if she'll take me. And thankfully you did. And then we have our discussion. But one of the things in that calculation, that Tyrer-Cuzick, can you talk to people about what that is and kind of what that means?
Absolutely. So, any woman who comes into our office, even if they're not here for family history, if they have a mammogram that they just want me to check out, if they have a family history, we do a calculation called the Tyrer-Cuzick model. And that takes a lot of different information that I'll kind of explain the different parts, puts it all into a computer program that some very smart people created. And based on that, shows us what is the likelihood that someone's going to get a breast cancer compared to the average woman. And so information that goes into that is pretty varied. So how old someone was when they started having periods, if they're postmenopausal, how old they were when they stopped, how many kids they have, and how old they were when they first had kids, if they did. Information about the breast density on mammogram, because that can affect things. And then we go into a pretty extensive family history. So that is children, siblings, parents, aunts, uncles, cousins, grandparents, all those get included, how old they were when they were diagnosed. And we also go into the people that didn't have cancer in the family. That all gets put into this program, and then gives us information about what is someone's risk. And then based on that, we tailor specifically to that woman, what did they need for follow-up? As I said before, do they need extra stuff to make sure that they're aware?
And that whole experience, I'll be honest with you, started more conversation with me and my family because I knew
Mhm.
a little bit about my mom's side. I had enough information there, but then kind of digging through my dad's side of the family, and there were some things that I thought I knew. And then we started to discuss it more, and I was like, wait, but I thought this is what happened. They're like, no, no. I was like, where have I
Yeah,
been?
right.
And right. And so that's when I really started to say, like, we have to start having these conversations
Mhm.
and start knowing more, because the more you know, I mean, that calculation was, I know your assistant, I was like, I feel so bad because here I am, a physician who talks to people all the time about know your history, know the things. And then she's asking me questions, and I was like, I don't know. I
Mhm.
don't know.
It is so common, Ashley, and, it amazes me how oftentimes I chat with people and then they go back and talk to family members, and especially kind of, a generation or 2 beyond us, they didn't talk about stuff.
Mm-mm.
So when people got cancer, you are not going to say that. And so people think there's no family history. And when they actually start talking to people, it's amazing what can come out of the woodwork that people didn't know, but it absolutely affects your health. And
Mhm.
most families don't talk about it. It's in the past, it doesn't matter anymore. But it does matter.
It does. It absolutely does. The other thing I wanted to ask you about, I know we talked about some other preventative measures. What are your thoughts on breast self exams?
That's kind of a difficult one. So I really feel that should be tailored to every woman. So I think there are some women who know their bodies and absolutely should do them, because I believe, I forget who came out with the recommendations, but they actually recommend anymore that women don't do them. And
Mm.
I absolutely have had women come in and say, I felt this lump, and it sometimes it is a breast cancer, and it may be in between mammograms that they're on track with their mammograms, and it's in between. And so but yet I also see women who say, if I do a breast exam every month, I would be in here every month because I have no idea what I'm doing and it
Mhm.
freaks me out and I don't know what to do. And so I really tell people to do what they feel comfortable with. If they feel comfortable, they know their bodies, keep doing it every month. But I also don't feel that women are harming themselves if they're just too scared. Because the other thing I tell people is we're all doing exams whether we know it or not, because
Mhm.
we take showers, we clean our bodies. So we are checking ourselves out, even if we're not
Mhm.
actually aware of it. Um, Women who are intimate with others, I've had people come in and say their significant other,
Mhm.
found a lump. So um, I think for some women, it's a really difficult thing. And to me, I'm all about no guilt. Do what you feel comfortable with, do what makes sense. And then I also tell women, if you are going to do it, you're really looking for something that stands out and is really different. You're not trying to find subtle things. If you're coming to me saying, I'm not sure, does this feel like the other side? It kind of does, it kind of doesn't. Like, we're not worried about that part. We're looking for, oh my goodness, this is really different. I've never felt anything like this before.
Mhm. Okay, those are good points, because I've encountered that, because I've had some people say, I don't even know what I'm feeling for. I don't I don't
Exactly.
know what
Yes.
I'm
Yes.
doing.
I get
Yeah.
that all the time. And I tell them, you'll know it when you feel it. Like, I know you
Mm.
don't know, but I've had women and say, I had no idea what I was doing, but I knew this was different.
Mm. Okay, that's good. And you're right. Women, we have our intuition. So, like you said, like
Mhm.
I don't know. I don't know if this is right or not, but I know this is different. And then
Yep.
that tells you, okay, I need to see someone and have them to evaluate it. Are there any other tips or comments that you would like to make?
Um, what else? One other thing as far as the family history that didn't quite talk about is the genetics component. And
Mm.
so, not very often, but some women have genes that can cause breast cancer. And if we can find that out before a woman gets breast cancer, sometimes we can even prevent cancers. And so, along with when I see people who have a family history talking about what is their risk, I also talk to them about genetics. And would it make sense for them to do genetic testing to figure out, is their risk actually even different than what we think based on that Tyrer-Cuzick model, that it could maybe even be different because that there is a gene causing cancer in the family. And so we talk to people about that also.
That is a really good one because my mother, she did genetic testing, and from her interpretation of it, everything's okay because that's what she felt. They told her, your girls don't necessarily have to be tested. We're okay. Well, then you and I were talking, especially with some of my other side of the family history. It says, well, maybe because we're not quite clear about this one cancer that was there, let's consider talking to the genetic counselor. And I sit down, I talk to her, and she made things make more sense. And so she has my mom's results, and she looks at them, and she says, yeah, but technically. And I was like, oh.
Right. And
Right. Yeah.
that's the hard part of even comprehension, because these are highly complex
Mhm.
things. And so, people just take away, is there something major I need to do or not? Or sometimes there's more subtleties that's hard to
Yeah.
know.
That's exactly right. And then I was talking to my cousin about it, and they said, well, because of this, why isn't everyone just being tested and have their genetics and to see if they have it? And I said, well, I cautioned them because I said, talking to the genetic counselor, if everyone did that, there can be a lot of confusion. It's because it's not like, oh, everyone should just get tested and then we go off of those tests. There's so much more information that
Hmm.
goes along with it to help make a decision on, should we continue with the testing, should other people get tested, like it it can just, because it's not 100%. That's the other thing, like we're still figuring out the genetics of everything.
Hmm.
But going on that side and going through this journey, I'm just realizing quite a bit.
Yeah, it's amazing. Like you said, even as physicians, if it's not in our, bucket, it's still a whole new world to us too. So absolutely. Hmm.
Right. Well, I absolutely appreciate you coming and spending your time talking to us today because there's so much information and misinformation that's out there, but you've provided some very clear, preventable tips that we can use, but some other things to kind of think about because, like you said, some of these are not like a get out of jail free card, like, oh, well, I'm fine, I'm okay. But we still have some due diligence that we have to do. There's some things that, okay, well, this happened. Maybe I should get this checked out. Have those conversations with your provider so that way they can see, yeah, let's go ahead and go to breast surgery and see if there's some further evaluation that needs to be done. So that way you will have this plan for your life and to kind of navigate this with your family as well. So
Hmm.
I appreciate you coming. I truly do.
Well, thank you, Ashley. I truly feel passionate about what I do. I love sharing this information, trying to help women get, real information out there. So thanks so much for having me. I really do appreciate it.
You're welcome. Well, you guys, thank you again for tuning in. And until next time, we will see you soon. And we are wishing you healing.